Ladies and gentlemen, a very good afternoon to you once again. Welcome to our final session of this year's symposium, our keynote address. Before we do anything else, if you have a cell phone, if you have a pager, please turn it off and put it away right now, please. It's my very great pleasure to introduce to you the man who will introduce our keynote address, our very own President, Dr. Barney Forsyth.
Welcome back. It's been a great day to be a Blue Jay. All right. We still got plenty of seats, so come on in. Actually, this is the last session of the first day of the Symposium on Democracy. We hope you'll come back tomorrow morning for some more stimulating conversations on this important topic. Well, I hope you're enjoying this symposium as much as I am. This is really one of my favorite times of the year, when we come together as a learning community to explore a particularly complex topic in great depth and learn together, all of us side by side. And this has certainly been a very exciting, very important, and very timely topic as we look at the subject of global health. I've been particularly looking forward to meeting and introducing our keynote speaker for today. It's really a privilege for me to do so for a variety of reasons. First of all, it turns out that we were neighbors in New York. We lived, our speaker had a house across the river from West Point in Garrison, New York, and so we probably looked at each other across the river from time to time on the weekends and said hi, and it's nice to now welcome you to Fulton, Missouri. More importantly, I'm excited to introduce our keynote speaker because she is a person who has lived Westminster College's mission. A leader of character whose life of service has made the world a better place for all people. Carol Bellamy has devoted her entire life in the private sector, in the public sector, and in her humanitarian work to leading and serving on behalf of others. And that's at the core of our college's mission. She earned her undergraduate degree from Gettysburg College and a law degree from New York University. And she had a distinguished career in the private sector, working for many years with such firms as Morgan Stanley, and for 3 years as the managing director of Bear Stearns and Company. She served for 8 years in the New York State Senate, and in 1978 she became the first woman ever elected to citywide office in New York as the president of the New York City Council. From 1993 to 1995, Carol was the director of the Peace Corps, the first former volunteer ever to run that organization, having served for 2 years in the 1960s as a volunteer in Guatemala. In 1995, she became executive director of UNICEF, the children's agency of the United Nations. And during her distinguished 10 years of stewardship in that position, she stepped up UNICEF's work in emergencies, doubling its funding, and she put the issues of children's exploitation on the global agenda. And she fought for the health, protection, and education as fundamental rights for every child. Until recently, and indeed until just a few weeks ago, in fact, she was deeply involved in humanitarian service as the president and CEO of World Learning, a nonprofit organization with operations all over the world that's committed to fostering global citizenship, addressing the most pressing global issues of the time, and promoting social and economic justice. And now, as she says, she's doing a bunch of things, and I'm sure she'll explain some of those things later. I think that today's address and her sharing her thoughts about women and children, the global health challenge, will tie together many of the themes that we have heard today in our symposium. So please join me in a warm Westminster College welcome for Carol Bellamy. Carol.
Thank you very much. Well, I'm delighted to be here, and I'm glad you cleared up the fact that this isn't the end of the symposium, so things can get better after I'm finished. I fully appreciate I'm now the only one standing between you and dinner, or at least a fun evening. However, I hope I'm helping you win your iPod at the same time, so I want to do that as well. I want to congratulate Westminster for being so, for its vision and being able to see the future and choosing maybe over a year ago that global health or focus on health should be the issue. Who knew we'd be spending every living, waking moment talking about health? So I'm glad we're also talking about global health. I think it's also interesting, I just point out that you hold this symposium on this international topic on the day of the opening of the General Assembly, of the annual opening of the General Assembly of the United Nations. So it is a particularly interesting international day, if you will. All the heads of state come to the United Nations. At least over the next week they will come. Anybody here know who speaks first at the opening of the General Assembly? Brazil. Who said Brazil? Yes. Very good. Well done. Brazil, for historical reasons. And then some guy named Obama comes in second, but President Brazil speaks first. This is his last term. It might be a possibility that Brazil will elect a woman president next. I wonder when, we'll probably come in after Papua New Guinea finally getting a woman president in the United States, but we'll see what happens. Thank you very much for saying that I represent the Westminster mission. As I understand, it is a mission very much focused on making a difference in the world. I've wondered at some points, I've been lucky enough to do a number of different things. There are times I worry that perhaps I haven't always represented that mission as well as I might. I mean, there was a time in my life when I had been and I like doing all of these things, I should tell you. I've been lucky enough to do a number of things, but there was a period of time in my life when I'd been a Wall Street corporate lawyer and an investment banker and a New York City politician, and I thought I only needed to do real estate, and then I would have been in every sleazy profession that one could be in. So I did try and redeem myself a little bit, both by doing what for me was the most important thing I ever did, which actually was to be a Peace Corps volunteer. Of course, I had no idea what I was doing. And then over the last close to 20 years working in the international field. So I am going to talk a little bit and then glad to take some questions or whatever you want to yell at me, that would be fine. You may hear a little repetition on, I've sat in on a couple of the sessions and you really can't talk about global health without, for example, talking about under 5 child mortality. So you may hear a little bit of repetition from other speakers today. But this is a critical indicator, not only a health indicator, actually. It's a very critical indicator when it comes to poverty. And while my colleague from Bread for the World talked about the 400 jumbo jets crashing, I want to talk about Michigan. Anybody here from Michigan? Okay, well, I'm not like talking nice about Michigan, but I'm not talking bad about Michigan either. I only want to point out that if the entire population of the state of Michigan died within 1 year, sorry, I have nothing against Michigan. It's a very nice state. If the entire population of the state of Michigan died within 1 year, shockwaves would reverberate around the world. Yet, as you heard if you listened earlier today, about 9 million deaths each year, that's about 26,000 a day, of children under the age of 5 barely even provoke a tremor. And the fact that 2/3 of these deaths are preventable makes this statistic even more tragic. Like a canary in an oxygen-deprived coal mine, the condition of children and women across many parts of the globe is a reminder that despite the scientific and technological breakthroughs of the 20th century, many challenges remain, certainly in the health field, if not in others, as we charge into this 21st century. Nearly 4 million infants do not survive the first month of life. I want to come back to this in a moment. 1 child in 6 is severely hungry. 1 in 7 receives absolutely no health care. Over 1 billion people do not have access to potable water and decent sanitation. And that in spite of the fact that vaccine-preventable diseases are on the decline, malaria, diarrheal disease, child and maternal malnutrition, acute respiratory infections, unhealthy home environments, and accidents cut down children in unfathomable numbers across the globe. And I want to mention education because it's critical to this. Somebody asked the question before of what would you do on a sustainable basis. What I do is make sure that every girl got an education, because if every girl gets an education in this world, every boy is going to get an education. It's not necessarily the same way around if you take it the other way. In any case, education is vital to the health and development of children and young people. While data from official school records indicate that about 77 million children of primary school age are not enrolled in school, we really need to be mindful of the fact that evidence from different surveys suggests that as many as 104 million children of primary school age are not attending school, and about 2/3 of those are girls. Quality education has been shown to enhance their economic opportunities, empowerment, improve their ability to survive pregnancy. Girls who get an education, particularly girls who get an education, you've heard the saying, you educate a boy, you educate a man, you educate a girl, you educate the community. There is empirical evidence that a girl who gets a basic education, 6 to 9 years, is more likely to grow to a healthy adult. Her children are less likely to die under the age of 5 because she knows how to take care of them a little bit better. She is less likely to become a victim of HIV and AIDS because she's less likely to be a victim of violence. No guarantee that that won't happen in some cases. And her family situation is more likely to be stable. She may still be very poor. I'm not talking about becoming rich, but stable. Now, here's my next test question. Who did the substantive, real, investigative work that showed the importance of girls' education? It's a great feminist educator. Larry Summers, actually, is the person, to tell you the truth, who did the earliest, very important work in the area of girls' education. So I must say that he's had good moments and bad moments, but I will always hold him in regard because of the work that he's done on girls' education. So you've got these health statistics. You've got the fact that there's still 100 million kids of primary school age who are not in school, about 2/3 of girls. And then you've got child and maternal issues closely intertwined. More than 500,000 women die each year of pregnancy-related causes. It is stunning that an African woman runs a risk of dying in pregnancy and childbirth, and this is a lifetime risk that is 400 times greater than the risk borne by women in this room and by your sisters and by your mothers and by your daughters and by your female colleagues, at least if those colleagues are in the United States or in Western Europe. And a child whose mother dies has 3 to 10 times greater risk of death than one whose mother survives. With the continuing spread of HIV and AIDS, and let me be very clear, and I know there have been some breakout sessions on HIV and AIDS, HIV and AIDS has not disappeared. I wear my red ribbon. People come to me sometimes, they go, oh, what? Remind me, I used to know what that stood for. We've lost the urgency I believe, in the industrialized world around HIV and AIDS. Not because it's gone away, but because in many instances, some of the communities, particularly men having sex with men, in those communities, there is disposable income, and we're able to at least treat or control HIV and AIDS. But it continues to grow in the most marginalized communities, even in the industrialized world. And in this country, for example, among minority women, it continues to grow. But it is a pandemic that is global. It's not limited to a particular continent, and it isn't the same picture everywhere. Yes, the prevalence rate of HIV and AIDS may be higher in some sub-Saharan countries. For example, let's say there's a 35% prevalence rate of HIV and AIDS in a country like Lesotho in southern Africa. But in a country where the population is 1 million, it's far fewer people at 35% prevalence rate than less than 1% in a country of 1 billion, such as India or China. So AIDS is a global pandemic. In some of the countries where it's growing the fastest, although the numbers aren't as great, are in places like Ukraine and Estonia. So let's understand that the HIV and AIDS continues to spread, and with that spread, development gains are being reversed, widening disparities and frustrating efforts to reduce poverty and hunger, to provide a primary education, and to reduce child and maternal mortality. Every minute of every day, a child below 15 years of age dies as a result of AIDS. And for all of those infected, there are many more affected. School systems have been decimated as qualified teachers and school administrators have fallen sick or have died from AIDS. There are some countries that aren't able to train as many teachers each year as they lose each year to HIV and AIDS. Children are also dramatically affected by the changing geopolitical reality and its impact on peace and security. Children's development will not succeed unless they can grow in a secure and peaceful environment. Today's wars are increasingly concentrated in the most disadvantaged countries. The face of war is changing in the world today. 50 years ago, I'll explain when I say the face of war is changing, and it's probably changed over many years. I'm not a historian, and I beg forgiveness for all you historians here. But 50 years ago, 1 civilian life was lost in wartime for every 9 soldiers. Today, it is 9 civilians for every 1 soldier. And what's happening is, because war today largely, other than you turn on the television, you might see some people in uniform, but most wars today, 50 of the 55 wars since the mid-90s are basically wars within countries, involving multiple parties and many different factors, tribal, religious, ethnic, all different levels, such as religious, such as that. And the net effect of that is it's like the Roto-Rooter grinding in a country, and it just devastates the services in a country, and it falls particularly harshly on women and children. Not that they are necessarily victims by virtue of being shot or killed in the war, but they are victims as well as being displaced, as not being able to go to school, as becoming homeless, increased incidence of violence, the amount of increased incidence of gender violence, particularly in conflict. The compounding factors of poverty and war expose children and women to violence, disease, hunger, homelessness, exploitation, and abuse. So, is it only bad news? Well, no. Over the past 25 years, progress has been achieved, actually 25 to 30 to 40 years. Progress has been achieved on the goal of eradicating extreme poverty. That is the good news. But the gap between rich and poor is not closing. Instead, inequalities and disparities are becoming more visible, more exposed, and significantly more intractable. There are those who would argue that poverty and exclusion have always been with us, and they always will be. I, on the other hand, would submit that the persistence of this level of poverty and the grotesque inequality that underlies it is on a scale unlike anything we have ever seen. And as we in the more affluent neighborhoods of the world are coming clearly to understand, poverty's effects include not only suffering, but rage. Thus, in spite of the significant progress achieved, much remains to be done, both in developing and in industrialized nations. and our unfolding and still growing global financial crisis affecting all our nations stands as a sad and yet critical reminder of the urgency of our work. Indeed, if anything, this crisis gives us an opportunity to test how serious and lasting our commitment truly is. Practically speaking, children around the world need concrete action from us, and they need it now, in the present. Children are about the present, because for children, time is always of the essence. High-sounding phrases don't feed their empty bellies, or cure their illnesses, or keep them safe from rape. Governments have to do more, give more, but we can't expect they will do enough, and we suffer, unfortunately, from a terrible lack of global leadership. Citizens will have to do more, give more, but we can't expect them to do enough. Still, we must press them to act, and we will be aided in that effort, in my view, by the logic of the demographic. So, as I told another audience recently, I'm going to talk a little bit about demographics. About 80% of the world's population today lives in developing and transitional countries. And roughly half of this population is under the age of 18. In today's global economy, a majority of a large multinational corporation's workforce will be located miles and several continents away from its headquarters. More than half of the revenues of the world's present 40 largest multinationals will be earned abroad, and 2/3 of sales will come from other than their country of origin. The bottom line is, no one can afford to ignore the health, education, and well-being of the world's young. There is a youth bulge in the world today that bulges largely in developing and transitional countries, and if we think we can isolate ourselves from it, if we think we can build fences around it, we are fooling ourselves. That being said, the best news, and there is good news, is that what is required doesn't even have to cost all that much, and I'm going to talk a little bit about some figures. Indeed, investing fully in children's health and education today will ensure the productivity of future generations to come. And on top of it, for the most part, particularly when it comes to health, we know what interventions work, and we know what it costs to get there. So I want to talk a little bit about, there's a, again, my colleague from Bread for the World mentioned before a number of types of interventions. I'm not going to mention them all, but there are about 30 or 32 of them. And we know that the cost of scaling up the 30 newborn and child health interventions in the 60 countries with 94% of all child deaths has been pretty clearly estimated, and we know pretty much what it's about. And since this conference was not only about talking about the problems, but how do we confront those problems, what do we do about them, I want to make some suggestions. They're not mine. The point is, we know what we need to do, we just need to get out there and do it. Of those approximately 9, the latest statistics say it's slightly under 9. Of the slightly under 9 million under 5 deaths, more than 60%, about 6 million lives, and that includes 2.5 million neonates, could be saved through an additional investment of only $7 billion a year. Let me put that in some perspective. The only person I saw starting to sweat when I used the $7 billion was your development director. But the fact is, let me put $7 billion in perspective. It is less than 10% of what was spent in 2005 on tobacco products in the United States. It really is, as global figures go, a very, very modest figure. And when we talk about under 5 mortality, I wanted to come back to this because there's some interesting things. Because there have been real advances in reducing under 5 mortality, it's very interesting if you start to slice it, what happens is you find about 40% of under 5 mortality today are actually what are called those neonates, which means in the first month of life. And what does that mean? It means that we need to think not only about what we do for that newborn, but what was the situation of the woman as she came into pregnancy? Was she anemic? Was she beaten? Was she malnourished? Did she get no prenatal or antenatal care? And so very modest investments in again, that woman makes a very big difference in reducing the number of lives. So that's $7 billion. Overall, about 80% of those costs are for preventing, not treating, but preventing the disease in the first place. And so I'm going to illustrate with some of the biggest killers of children. These are the four biggest, pardon me, four biggest killers of children. I'm from New York, we can't count. Four biggest killers of children. Pneumonia. You may not have realized that, but pneumonia. And one of the challenges there, see, you get the things that kill children in poorer countries, and if they aren't killing children in richer countries, there's not an incentive to go out and find the cures for them, which is one of the problems. But pneumonia is responsible for 19% of deaths of children under the age of 5. That's about 2 million deaths annually. Treating this with antibiotic treatment, you can do it per child for about 30 cents. Diarrhea. And we've made improvements in reducing deaths due to diarrhea. Again, this is largely due to lack of clean water. Well, frankly, to tell you the truth, if any of you are water sanitation people out there, there actually has been significant improvements in access to clean water in the world, but that has not been matched by a similar access to good sanitation. And if you don't get better sanitation along with clean water, you're not getting the benefit of the clean water. So, children get diarrhea, then they get dehydrated, and particularly if they're malnourished, diarrhea-related deaths are very, very serious. They're responsible for 17% of deaths under 5. That's about 1.8 million a year. That's treatable with these little packets of oral rehydration salts for about 20 cents. Malaria, responsible for 8% of deaths under 5, that's 850,000, but malaria is still the #1 killer of children in Africa. So while it's not #1 on the hit parade of killers of children, pneumonia is, it is the #1 killer of children in Africa. We now have available the capacity to treat bed nets, insecticide-treated bed nets for long terms, costs $5, but it lasts for a couple of years, and it is also very often usable, should be used certainly, not only for the youngest children in the family, but for the pregnant women, and so it's really a very small cost. And measles. Measles is a disease that we don't think a lot about in this country, but measles is a disease that kills. Measles, responsible for 4% of under 5 mortality, is prevented by a jab in the arm, which costs about $1. There's been an incredible advance in the last couple of years in terms of reducing measles diseases. In just 6 years, measles vaccinations reduced child deaths due to measles by 60%, from nearly 900,000 in 1999 to about 400,000 in 2005. While some of these kinds of interventions are actually very inexpensive, some cost more. I mean, for example, improving access to water and sanitation costs more, but in the long run, the multiple return on the investment is so much greater than the investment in the first place that it really makes sense to do it. Again, I also come back to the connection of women and children, and not just women as bearers of children, but women as human beings, because the more this woman is not a victim of violence, the more this woman has an opportunity to get an education, the more she's able to take care of her children and take care of her family and take care of herself. But the survival of mothers and newborns and children and women is intertwined, and they all benefit from a focus. Enabling women to space births and to prevent unwanted pregnancies, and assuring that there is some kind of skilled attendant present at birth are critically important child survival strategies. Providing maternal care to 75% of women in the 75 highest maternal mortality countries would require, on average, about $4 billion a year. So I'm up to $11 billion. That's it. It's not a huge amount of money, and we could reduce the impact, the dramatic impact on women and children to a greater degree than we've seen in decades. Health has long been recognized as an important determinant of human capital and productivity. The other side of that is, unfortunately, poor child and maternal health undermines societal development, while improved children and maternal health is the first step toward allowing there to be a break out of the cycle of ill health and poverty. So not only do the logic and pressure of global market activity and the distribution of world populations compel our urgent attention to the health and well-being of the young, it actually is that we can do a lot to improve things by investing much less than we imagined. What is needed is not to yield to the normal human disposition to put off tomorrow's work, to put off today's work to tomorrow, or until we feel better about it. Because for the children of the world, certainly, and for the women of the world, tomorrow may just be too late. And the other trick is just not letting ourselves feel helpless in the face of the magnitude of the overall challenge. It is depressing that despite our having legally and nearly unanimously committed the nations of our globe to preserve, enhance, and advance children's status, and I'm speaking here about the fact that all but 2 countries in the world have signed on to the most globally ratified international treaty, the Convention on the Rights of the Child. Of course, one of the 2 countries that is not is our country, or this country. Despite the fact that all but 2 countries have, it is depressing that each day brings us pictures of starving and brutalized kids and grisly stories of their untimely deaths in places like Darfur and Afghanistan and Gaza and New York City. Almost as bad each time we turn a page or shift the channel or decide not to send out a check to our favorite nonprofit or fail to vote in a by-election. In small ways and large, we are or feel ourselves complicit in the evil. So what are we supposed to do? Well, I think sometimes people wait for heroes to solve all the problems. And yes, we do. We have the Bonos of the world, and we have the Oprahs of the world, and we have the Bradgelinas of the world. And I'm prepared to acknowledge, actually, they all do a pretty decent job. But I want to stand here and I want to leave one message, that a person with a first and a last name can also make a difference in the world. And by that I mean you. Yes, we have a right to be concerned with our own personal needs and the needs of our family. We do. But that doesn't exempt us from caring about the rest of the world. Hopelessness and despair, I find, are often the product of a false syllogism. The challenge is so enormous, I can't do it all, I'll never finish the job, I better not start. But that's exactly the point. All that you're asked to do is what you can, just to begin, to break down the tasks and find those portions where you can make inroads. Only from a very long distance can we see the whole path that will be followed. As we are engaged in our efforts, we should take comfort in the wisdom of Dorothea Day, the great Catholic worker leader, who reminded us that in the end, we gentle the world little by little. I challenge you all to go out and gentle the world little by little. Thank you very much for inviting me here. And I would be glad to take a question or two, if there are any. Sure, I think you have to come to a microphone, actually, or a microphone comes to you.
Okay. That was a very good speech, by the way. In 2000, world leaders came together to sign the Millennium Development Goals. Now we are left with 6 more years to complete these goals. And from my understanding, the story is not too good. Even though some countries have made some achievements, most countries have not yet done what they are supposed to do. Now, in your opinion, what do you think is the greatest challenge to us achieving the Millennium Development Goals by 2015? And also, if you had the opportunity to address the UN General Assembly today, what advice would you give to world leaders?
Well, first of all, I addressed the world leaders by saying we need some leadership. And I mean that seriously. But let me, in 2001 was really the culmination of the whole decade of the 90s, in which there were a whole series of international conferences that are generally known by the city where the conference was held. So there was the Cairo conference, which was the conference on population. There was the Rio conference, which was the conference on environment. There was the Beijing conference, which was the conference on women. There was the Copenhagen conference on social development. There was a special session on children in 2001. And then in 2002, sorry, it got postponed because it was supposed to be on September 16th, 2001. And then there was the Millennium Conference, and there was two things. There was a Millennium Declaration, which actually is far stronger than the Millennium Development Goals. I mean, the Millennium Development Goals are good, they're important, they're about poverty and hunger and maternal health. Well, they're not very much about maternal health. That's one of the problems, because they're very political, and there was a coalition that kept it from being very strong on maternal health. But it's about education, it's about water and sanitation. In response, frankly, many countries will achieve the MDGs as they are known, but most of the poorest countries, and in particular sub-Saharan African countries, will not achieve the Millennium Development Goals, and they will be far off from achieving the Millennium Development Goals. And the first goal that came due was in 2005, which was the gender equity goal, and that was barely achieved. The problem is, in those countries that will achieve the Millennium Development Goals, let's use, I don't want to pick on Brazil, I feel badly about Michigan already, but I'll pick on Brazil for a moment. I'm not picking on them, they've been economically very good, but because these are percentage goals, Brazil could achieve the Millennium Development Goals and still not really make much of an inroad in their most marginalized and poorest communities, which is the Afro-Brazilian community. So you have two different things. You have widespread not achieving MDGs in most of your sub-Saharan countries and in critical parts of India, frankly. UP and AP as two states, for example. And then in other countries, in Asia and in the Americas, you probably are going to achieve the Millennium Development Goals, but you're not going to achieve them in your most marginalized communities. For example, in communities like your indigenous communities, your hill tribe communities, your mountain communities, your Andean communities. And in those communities, in those countries, the conditions are almost as bad as in sub-Saharan Africa. So, two things I would say. One, I worry about setting goals that far out. Now, 2015 is getting sooner, but this was set in 2000. And one of the problems about setting goals for 2015 in 2000, if you're in politics, I spend a lot of time in politics, is you say to yourself, oh, that doesn't come due in my term. And so there really isn't the pressure to deal with it. Secondly, frankly, I happen to think the MDGs, as good as they were quite top-down. And it took several years to even start getting there to be more of a bottom-up approach to trying to deal with the MDGs. And I just think we have to be very, very careful going forward about having this top-down approach. So I think those are some of the reasons. And again, I would, my first thing to leaders would be the desperate need for leadership. My second would be that there is no more important investment in any one of their countries for economic growth, for peace and security, than to invest in making sure that every child has decent health care and every child gets an education. That would be my second.
You said that all but 2 countries signed that particular treaty. Do you know why the United States did not sign it, and who was the other country?
Yes, the Convention on the Rights of the Child, now, needless to say, if there are countries like DPRK, North Korea, and others that have signed it, and I mean, conditions are not good for children, so just because they've signed it. But nevertheless, the Convention on the Rights of the Child is the most widely ratified international treaty, and it has served as, it actually has gotten some legs And it serves as something that advocates in these different countries can use. It serves sometimes as something the Minister of Health or the Minister of Education can use in fighting with the Minister of Finance, frankly. These kinds, I mean, it has become a valuable tool, although as one can certainly see by the number of child soldiers and child trafficking and other kinds of things, just because a country is signed on, it doesn't mean that that country is respecting its children. The two countries that have not are the United States. I always say that the two countries that are not are Somalia and the United States. Somalia because it doesn't have a government, and the United States because it has too many governments, but that's a little facetious. The U.S. has historically, as I think many people are aware, been very, and this has been in Republican and Democratic administrations, has been suspicious of international treaties. It argues a range of arguments that it has some implications for states' rights. Again, I won't give you the legal arguments, but frankly, countries like Canada with very strong provinces and Germany with which is a federal state, both have done that, and it hasn't taken away any of the power of local government, for example. And the U.S., that's one argument. The second argument is U.S. says it can only consider one treaty at a time, and the treaty it's still considering is the Convention on the non-discrimination against women, and that went to the U.S. Congress for ratification in the early 1980s. So that's still pending. So it says it can only do one at a time. And then third, and this is actually, those two apply kind of to all treaties, and the third is, this is very specifically applicable to the Convention on the Treaty on the Rights of the Child. There is a vocal, small but vocal, and very active, this is my description, and I respect them, I disagree with them, but respect them, small but vocal and active minority of folks who argue that if you give children rights, you're taking away parents' rights. And again, I think if you read the convention, it's very clear that the parent is the primary caregiver, but those are three of the reasons why.
I remember a couple of years ago when they asked Kofi Annan what was important, whether national sovereignty or intervention in other countries. He said nothing could stand in front of global values, humanitarian values, not even national sovereignty. But today, we still see in places like Darfur, as far as I'm concerned, UNICEF is the only non-profit organization staying in Darfur and helping people. This is somewhat of a discouragement for people who are wanting to go out there and make a difference. The fact that the politicians of such countries make national sovereignty such a big issue that they prevent other people from helping maintain global health. How do we overcome that problem?
Well, I actually think that it was one of the most important speeches and concepts that Kofi Annan, and I think he did a good job, promoted. It became incorporated in something called the right to protect, and it was a concept promoted by the International Crisis Group, promoted by many leaders around the world. But it's also a concept that, which wasn't that any country could just intervene in another country, but it was a concept that was premised on the fact that you could not, that the United Nations and others anchored in one of the pillars being human rights, that you could not hide behind sovereignty in the context of horrendous human rights abuses. That if these horrible human rights abuses were going on in your country, to say that this is an internal matter. And as I said before, war, the shape of war has changed so much, and so many things are going on within countries. So this was a concept that had started to gain some ground, but has recently run into some very serious challenges. The most recent President of the General Assembly from Nicaragua, he has just finished his term, recently held a a conference in which the issue was denounced. And again, I'm giving a personal view. My personal view is this is a very important concept, but it is losing ground, and governments who want whatever they are doing, and you know, we know what happens sometimes by the richest governments as well as the poorest governments engaging in behaviors that are really antithetical to decent human behavior, then argue that this is within their borders and it's sovereign. So I don't have an answer to your question other than to say that I think that is a concept that that we need to, I would argue, at least I will as a human being, continue to try and promote and be a supporter of this concept of the right to protect, to avoid allowing countries to cover up terrible, terrible actions. I want to say one other thing, and I appreciate your nice comment about UNICEF, but actually there are a number of NGOs in Darfur. The Red Cross is in Darfur, the International Red Cross is in Darfur. There are a number of NGOs in Darfur who've stayed in, some of whom have lost staff there. UNICEF is still there, but there are others who've made a commitment. One of the things that you have to see that's happening in Sudan right now is, for many, many years, the focus was on the war between the North and the South. That began to get resolved to some degree, and then the focus is on Darfur, and Darfur hasn't gotten any better, but in the last month there have been big, huge attacks in terms of the North and South again, and there's a great deal of worry about that, everything opening up there. So I know everybody talks about Darfur, and it's not that you shouldn't, but you should see Sudan as a much greater humanitarian challenge than only Darfur right now. They're good people.
Oh, wonderful. But I think it does seem very daunting, particularly to college students who don't have maybe jobs and things. How can I really help? What would be your suggestion on the most basic level of getting involved? Would it be through organizations that are already existent? Would it be coming together as a university community? For all of us, even myself as a professor, where can you really start to do something, even if it's just very, very tiny?
Well, my understanding is that many of you are already doing things here through your community service. So let me acknowledge that. This is not a challenge that folks here at Westminster are not doing that. And you know, there's not a book that says here's 1, 2, 3, 4. You might want to do it through your local church or synagogue or a religious institution. You might want to become involved just as a supporter of a particular nonprofit, depending on the field. If you're particularly interested in violence against women, and again, you don't have to make it a narrow, but you can. There's a lot of stuff you can find on the web these days. You can find a lot of crap too, but you can really find stuff much easier than you could before. Even a contribution, and I'm not even talking about a big contribution. Every contribution helps. Doing advocacy. I mean, we heard before sometimes both letters to members of Congress, but even a letter to the local newspaper, or write an op-ed piece sometimes, or join with others in writing an op-ed piece. If the capacity exists, a summer service project. You know, one can be a global citizen. Well, let me put it this way. A global citizen, in my mind, the definition of a global citizen is not how many stamps they have in their passport. So one can be as much a global citizen by getting on your bike and bicycling across town to work at the local food center as getting on a plane to go to Africa. I mean, it isn't all just international travel as such. I think it's what interests you and where you want to try and help, and if it engages you, that's really the good thing, because then you'll probably figure out something after that happens. But there's I don't have my Carol top 10 things you should do, or top 10 organizations. You know, I know sometimes people say, oh, I mean, I'm teaching some of the stuff I'm doing a course at NYU right now, and I had a couple students said I didn't want to work with any kind of religious organization. Well, you know, there are great religious organizations out there if one wants to. If one doesn't want to, one doesn't have to. But to make blanket things like that, it should be an area that interests you. I have one other suggestion too in that respect, and for those of you who are parents, sometimes something you can do is also use some global things as a good education tool for your children. Even if it's a tragedy, because you can sometimes say, well, here was a tragedy, but look how people responded, or look what happened to this. So I also think it can be used as an education tool, even with your own children, or children you care about, whether they're yours or not. I don't want to hold you. Sure.
Sometimes the organizations such as UNICEF, Red Cross societies, it seems to work more on city areas and urban areas rather than rural areas where the children and the women, they suffer more than the rest of the people who live in developed areas. You know? And then it's not only about, one of the examples is my own place where I come from. And it's not a matter of fact about my country or my place, but it's a matter of what the situation is. What is your opinion regarding it?
I have to say I disagree with you a little bit, although you've seen it yourself, so I don't want to say that what you've seen was wrong. I actually think that historically more development has been focused on rural areas, and if you look at population trends in the world, in many parts of the world, there's enormous growth of populations in the urban areas. Big explosion in urban areas everywhere. And what you have is, and then you also have to take a look at the statistics in the urban areas, because they're not going to look as bad, because in most, even the poorest countries, you've got some rich people. But you've got to drill down in those statistics. But in some of your peri-urban areas, whether you're talking about this Kibera, the slum right outside of Nairobi, or right in Nairobi, or those peri-urban areas are some of the worst areas that you can find in the world today. So I don't think that rural areas should be ignored, and there are some unique problems you're going to find in rural areas that you're not going to find in urban areas, but the intensity of the poverty in urban areas, and because very often you're going to run into more violence there, less community strands there, some of the coping mechanisms that people have historically had for years don't translate from the rural areas to the urban areas. I think some of the challenges for development in urban areas is greater. I mean, you know, I mentioned immunization programs before. There are some things you can do for children that you actually can count. I mean, you can count how many kids you give polio drops to, or get a jab, or a vitamin A capsule. But it isn't so easy to deal with street children just by giving them a jab in the arm. And so many of the urban issues, in my view, are actually very, very critical issues. And I guess I think that development has not focused on urban areas as much as it should. So I'm sorry to stop with a disagreement. Thank you all very much.
Carol, on behalf of the entire Westminster community, I want to say thank you for a wonderful talk. We talk about our outcome being preparing young men and women to be leaders in a global community. The way we do that is through education and inspiration, and you have been our best teacher in both areas today. Thank you.